Today I am going to talk about the gender incongruence and its overview a little bit. This is an emerging area of interest in the medical science, and all the physicians should know and little bit of this gender incongruence, because the physicians are the first contact person as far as this important issue is concerned. So I'll just give you an overview and to make you understand that what does this gender incongruence means, and when you identify this kind of people, then we should offer them a professional help. That is the most important aspect as far as this presentation is concerned. So I don't have any conflict of interest about this topic, but I treat only adult patients, and the science is not much developed in this area, so it needs more research so that we can fully understand all facets of the gender incongruence. Now, what is the definition? Gender incongruence means the incongruity between one's assigned sex at birth and one's perceived gender. Means somebody who feels that the sex assigned at birth was wrong, or you can see that the sex assigned at birth is not matching with that of the gender experienced by the person. Often this issue or the incongruence create a lot of trouble in the mind of the people suffering from gender incongruence, and we call them gender dysphoria. And therefore these are the two different terminology. One is gender incongruence, which there is a disparity between the assigned sexes at birth and the experienced gender. On the other hand, gender dysphoria refers to the suffering due to this important issue. Now, let me give you one small example. A 24-year-old woman presented with a history of strong desire to be a male. She was assigned female at birth, but she would prefer to dress like a boy and playing boyish games. Her behavior was encouraged by her parents as they did not have any male children. As she grew up, she started to get attracted towards women. She used to constantly feel that she was trapped in the wrong body and started developing symptoms such as worthlessness, anxiety, depression, suicidal thoughts, and suicidal attempts for the last 4 to 6 months. She expresses the desire to get operated so as to become a man. So this basically describes how a gender incongruent person feels about himself or herself. So somebody who is man wants to become women, and somebody who is woman wants to become a man. So therefore, the very, very important question, how many type of sex we have or how many type of gender we have. Now we all know that there are male, it is called Gandharvas. We have female, known as Apsaras, but we also have a third kind of gender known as Kinnaras. So this indicates that the whole human beings in this world cannot be divided into two groups, male and female. We have to understand that some, although their number may not be very high, but there are some people who don't belong to this classical or traditional division of male and female. And we actually put them under this umbrella term as third gender. But let me remind you that this third gender group is not homogeneous. There are many people or many diagnoses, and therefore it is quite heterogeneous group of people. But anybody who is not cisgender and who is not trans, who is not who is who is not heterosexual, we put them under this heading of third gender. So anybody who is not cisgender and who is not heterosexual, we call them under the heading of third gender. And many of them are actually gender incongruent. So this concept of this of the incongruity was there since long ago, and as you can see that these are the statues which were available for centuries together. Even in Ramayana, Mahabharata, there are description of the people who belong to the third gender, and therefore the concept was there for thousands of years, not centuries, but thousands of years. Not only on this part of the world, but in the Western world also, there are description of the people of third gender. And you can see that this marble statue, Greek marble statue of 2nd century BC, you can see that this person has both breast and the penis, indicating that the concept of this third gender was there since that period of time. So therefore, how we divide between these two group, traditional group? So those who are XY as chromosomal sex, who have the testis as their gonad, has male genitalia or the phenotypical sex, and they behave like a male, and we call them as a man. On the other hand, those who have chromosomal sex of XX, the gonadal sex of ovaries, the phenotypical sex is female genitalia, and they perform the female gender role. They feel themselves that they are women, their identity is women, and we call them as women. So now what happens that at any level there may be a problem. The problem may be at the level of chromosomal sex, problem may be at the level of the gonadal sex, problem may be at the level of the phenotypical sex. But today we are talking about the gender identity. When there's a problem at the level of gender identity, then we call them gender incongruent. So who are gender incongruent? So suppose a patient have a XY and then the testis, then have male genitalia, but they feel that they are female. They feel that they are trapped in a male body. So we call them transgender women, or sometimes we call them transfeminine. On the other hand, if the chromosomal sex is XX, gonadal sex is ovaries, and phenotypical sex is perfectly female extragenitalia, but their identity is male. They feel that they are actually male, but they are entrapped into the female body. Then we call them transgender man or transmasculine. So this is a disorder. Once it was described as gender identity disorder. It was a psychiatric diagnosis, and it was given to a person who had a strong and persistent cross-gender identification combined with persistent discomfort in one's sex or sense of inappropriateness in the gender role of that sex. And it caused clinically significant distress. So it was known as gender identity disorder. Later, the people thought that we should not call it as a disorder because it is a normal variant of human beings. So then they changed the term dysphoria, indicating that many of the patients actually developed some distress. But even after that, people thought that we should not call them as a dysphoria, but it is simply gender incongruence. all the people, those who have incongruity, may not have the dysphoria or the distress. So therefore, everybody who have gender dysphoria may not are basically gender incongruent mostly, but many of them who have gender incongruence may not have the dysphoria. So why it is important? It is important because physicians are very much aware about the type 1 diabetes. And we have roughly around 1 lakh type 1 diabetes in India. And every physician has got some idea about the type 1 diabetes. But very few physicians are actually aware of this important condition. We call it gender incongruity. And if we look into the latest census data of 2011, the government of India said that we have roughly 5 lakh transgender in our country. That is 5 times more than the type 1 diabetes. And very frankly, this 5 lakh is basically a very, very underestimated figure. Its number may be 10 times more than that. So therefore, all the physicians need to know about this condition so that they are sensitive enough to approach these people, and they should understand that how we should give them some kind of professional advice without any discrimination. Why we are talking about this? What is the risk if the patient has got this problem? Now you can see that we do not have much data about these people, but this data about in 2016 showed that 31% transgender has got suicidal attempts. So that is very high, very high. And you have to remember, those who have attempted and failed, they are only coming to the clinic. And those who have attempted and successful, they will never come to a physician to say that I have died from suicidal attempt. And if we look into another very, very important disease in which the possibility of suicide is very high, that is schizophrenia. And in schizophrenia, the lifetime risk is 5%. Whereas in transgender people or gender incongruent people, the suicidal risk is 6 times higher. So therefore, we have to be very careful in identifying them. We have to be sensitive about their problems so that a discriminatory approach don't push them towards the suicide. So you must have seen them in the roads, and many of them are actually transgender, and many of them are actually gender incongruent. So what is the take home? Take home is that gender incongruent identities should be recognized by the healthcare providers. So we have to understand that this possibility exists, and they should receive medical facility, medical treatment, professional advice without any discrimination. And a specialized training for the healthcare providers to become gender literate is the need of the hour. So we should be gender literate. And the health policy should include a focus on gender incongruent people to disseminate right information and reduce health disparities. So thank you very much, dear friends. So I think I have given you a little overview of the transgender people, and I think that you will take good care of the transgender people by giving your valuable advice so that they can lead a better life and so that they don't push themselves towards committing suicide. Thank you.